सुरू करा मॅडम.
Oh, good afternoon, students. Now we are going to learn the topic of basic biomechanics. I'm Dr. Vijaya Krishnan. I'm an assistant professor from MGM College of Physiotherapy. Good afternoon, everyone. For today's topic, the objectives are you should be able to define the terminologies that are taught, demonstrate the movements in anatomical axis and planes, describe the mechanical principles, describe muscle mechanics, and application to human body. Now, the basic terminologies that we are going to learn today are mechanics. So what do you mean by mechanics? It is the study of physical action and forces. Knowledge of physical principles governing the body, forces that affect the muscles, okay, and the body. Now, biomechanics is the study of these mechanics in human beings. It is divided into kinematics and kinetics. Now, when you talk about kinetics, kinetics is the forces that produce motion. So it is like, it is description of the motion. So they are type of motion based on the location of movement, direction of motion, the magnitude of motion, duration of motion. So all these define kinematics. Kinetics is the description of forces which produce these movements, and they are responsible for maintaining equilibrium. Now, kinematics is divided into two things: osteokinematics and arthrokinematics. Now, osteokinematics is the movement of the bones. Arthrokinematics is the movement of the joint surfaces. Okay. Now we come to two other terminologies which are known as closed chain kinematics and open chain kinematics. Now, closed chain kinematics are those where a body moves on a distal segment that is fixed or stabilized, like you can see in this figure. Okay. And the another figure that is there here down. The next thing is the open chain kinematic, where the distal segment is free to move, like that is shown here, where the movement is freely occurring, and here where you can see the knee extension that is freely occurring. So the distal segment is free to move. So these are the two terms which are attached to osteokinematics, that is closed chain kinematics and open chain kinematics. Now we move on to another important concept, that is axis and planes. As we all know, axis is a line about which movement takes place, and plane is the surface that lies at right angle to the axis in which the movement take place. Now, human body has movements occurring in three axes and three planes. So you can see the first one, that is the sagittal axis, the frontal axis and the vertical axis. So these are the three axes along which the movement takes place. Now, right angle to these axes, there are three planes, which are frontal plane, sagittal plane and the horizontal plane. So this is the figure that represents all the three axes and the three planes. So what movements happen in these axes? Now, in sagittal axis, frontal plane, there is a movement of abduction and adduction. So if you can see it here, you moving the hand into abduction and adduction. The next thing is the frontal axis, sagittal plane, where the movement occurring is flexion and extension. That is here. This is the frontal axis. This is the sagittal plane where the movement of flexion and extension happen. The next thing is the vertical axis, the horizontal plane where rotations happen. Rotations meaning internal and external rotation. So that is here. Now you can see the axis here. This is the vertical axis and the horizontal plane where the rotations happen. So these are the axis and planes along which movement happens. Now, next thing that we are going to cover, once the movement happens, we are going to talk about the forces that are going to produce the movements. So forces are again a mechanical concept which is very important for human body motion. Now, forces, what is a force? Force is a pull or a push in simple words. So it alters the state of rest or of uniform motion of a body happening in a straight line. So you either push or pull and then change the motion of the body. Now, types of forces. There are basically two types of forces. One is the contact force, the forces that act through direct contact between two objects, wherein the forces have to touch the objects. For example, these are applied forces to any body or friction which happens to motion. The second thing is the long range forces. Now, these forces can happen over longer distances. Two of those are the gravitational force that is there all around us and the electromagnetic force that is also present all around us. Now, what happens when you have forces that are present? So when you have forces, it is two in nature. When they occur in pairs, they can either be balanced forces, which means they are equal, or unbalanced forces, which are unequal. So now we see how forces in pair can act. Now the first body here shows that a single force being applied to a body. The body is going to move along the direction of the force. Now the second diagram here is forces which are happening at the same point and two of them. So what is this? The body is going to move again in the direction of the force. Now when you see this figure here, it shows that there are two equal forces which are opposite in direction acting at the same point. Now what is happening here is the body is going to move nowhere because these forces are equal. So both of them equally moving in opposite direction gives no motion. Now, when you have two unequal forces in opposite directions acting on the body is again going to move in the direction of the greater force. Same thing here, two unequal forces, but they are acting in opposite direction at different points. Now what is going to happen when to the body when two forces are acting at a different point? It's going to cause an angular movement or an angular rotation. Same thing, when two forces are acting at an angle here, the movement of the body can be predicted by resolving those forces, which is known as the parallelogram law of forces. So based on this, the movement of the body will occur according to the composition of forces. So these are all the different types of forces and how they act and how the body is modified or moved in which direction based on the forces that are happening. The next thing is the motion. So once you have forces, you know where is the force acting and how is it moving. We come to the laws of motion, that is the Newton's law of motion. So the first law of motion says that the things that are still stay still, the things that move continue to move in the steady direction unless acted upon by an external unbalanced force. Now the property that ensures that the body stays in continuous motion or in still position is known as inertia. It is the tendency of the objects to resist a change in the motion. So no object moves until and unless acted upon by an external force. Now we come to the second law of motion. Before that, we need to understand two terminologies, that is mass and acceleration. Mass is the weight of an object, mass of an object, which affects the inertia. So it affects the resistance provided by that object to motion. Now, objects with more mass have more inertia than an object with smaller mass, which has less inertia. Similar to these figures here, it is harder to move an object with a large inertia than an object with a small inertia. All right. Now, the speed at which this is moving is known as the acceleration, that is the rate of change of velocity. Positive acceleration is one in which there is increase in the velocity, and retardation or deceleration is when there is decrease in the velocity. Again, the change in acceleration or the movement depends upon the inertia or the mass of the object. So the second law of motion states that when a force acts on an object, it can change the speed or direction of the object. So it depends on the mass, and hence you can know the acceleration of the object. So bigger the force, more the object accelerates, and lesser the force, lesser is the acceleration of the body. The third law of motion, as we all know, is that force, when it's acting on an object, there is an equal and opposite reaction force which is acting towards us. So this is also known as all actions are equal and opposite. So there is an action and a reaction. So similarly, when you see this balloon, you fill the air is left out, the air rushes out, but the balloon moves up. So to action of the force that is coming down, the reaction is the balloon that is carried up. Similarly, we can talk about the push and pull that is there on the door. So one is the action force and one is the reaction force. Same forces happen when body elicits different movements with the help of muscles. So these are the three laws of motion. One is the law of inertia, or where you have the movement that is happening with respect to the force. So objects will stay either still or in movement. The second law, which depends on the force, so more the force, more is the object acceleration. And the third law, which gives you action and reaction. So these are the law of motion. Now we come to two other important forces which are acting on the body, that is friction and gravity. Now these two forces also affect motion along with the other laws of motion that we've studied. So let's talk about friction. What is friction? Friction is a force that is going to oppose the motion of an object. Now, as we saw earlier, it is a contact force. So for friction to happen, you need the force to be in contact with surfaces. Now, it happens when an object is in motion and it rubs against the surface. Now, contact reduces the speed of the surface and also releases heat in the process. Friction is that force which is going to cause slowing of the motion. What affects friction? So, the force of the push and pull. The harder you push, the longer it is going to take the friction to stop the object. So if your force is higher, it's going to take friction force to be much more longer in order to stop the object. The second thing is the roughness of the surface. So as we all know, rougher the surface, more is the friction. So even if your force is higher and if the surface is rough, it is easy to stop an object that is in motion. The another thing that is going to affect friction is the weight of the object. So heavier the object, more is the frictions and more force is going to be required to move the object. So these are the three main principles which are going to affect friction. Now, how do we reduce friction? Before we go that, we need to understand the types of friction. So first one is the static friction that is going to happen between two stationary objects. So when the surfaces are in contact and there is no force, what you see is static friction. The second thing is the sliding friction. Now this happens when one surface moves over the other. It can be uphill or downhill. The third thing is a rolling friction. This occurs when you have a rounded surface which rolls over another. Now, rolling friction is going to take a long time because it is easier to push a ball that is going to go downhill. So, a rounded object moves faster and hence friction force takes a longer time to act upon it. Now, as I said earlier, we are going to see the ways in which you can reduce friction. So, by use of wheels or rollers, by application of lubricants, where you create a smooth layer between the surfaces, and something called as sanding the surfaces. Now, what does this mean? This is when you are going to smoothen or polish a surface so that it becomes smooth and the motion happens without with less friction. Okay, so now these are different ways that can be employed when you're going to give exercises to patients, or when you're going to do simple techniques like massage. So lubricants, use of rollers and wheels, or simply polishing the surfaces will help you achieve smooth motion and avoid unwanted forces. The next thing that we are going to look up on is gravity. So what is gravity? Gravity is a long range force which is not in a contact force, and it is a force that is going to attract all objects, and it is depending on the object's mass and the distance between the two objects. So if the mass increases, the force of gravity also increases. If the distance increases, the force of gravity decreases. So if we want to have equal gravitational forces, the mass of the objects and the distance between them have to be monitored. Okay, so this is the gravitational force which is going to present itself on all beings which are present on Earth. Now, when you talk about gravitational force, you have something called as center of mass. Center of mass is that point on the body at which it is balanced. So, all the forces that are acting upon the body are balanced here from all directions. This is known as the center of mass. Center of mass is and in the earth is similar to center of gravity, which is again the point at which the force of gravity is going to completely be present. Okay, and now here you have rounded objects, that is shown here, which is the symmetrical objects. For symmetrical objects, the center of gravity is same as the center of mass, whereas for asymmetrical objects, the center of gravity is towards the point where the mass is larger. Now, there is another important concept that is known as the line of gravity. It is the line which passes through the center of gravity. So, if you draw a line from here, this becomes the line of gravity which is going to pass to the center of gravity. So, remember, center of mass and center of gravity for an object which is placed in Earth is similar because of Earth's gravitational forces. But when you go out of the Earth's gravitational field, the center of mass of an object and the center of gravity of the same object is going to be at different points. Okay, now we come to another important concept that is known as the stability. Now, for a person or an individual to be stability, there is another concept which is called as the base of support. The base of support is the space between the two limbs of an individual who is in this picture standing. So this area is known as the base of support. Now the base of support should be large enough for any individual to be stable. The second important rule is the center of gravity should be closer to the base of support. So the more this center point is closer to the base, the more stable you are. Like, you are more stable when you're sitting down, then standing, then walking, and then unilateral standing or jumping like shown here. Another important rule here is the line of gravity. The line of gravity is going to pass through the center of gravity and should fall within the base of support. If it's falling within the base of support, as you can see, any object in any position can attain stability irrespective of their size and shape. The three rules that need to be followed are: the base of support needs to be large, the center of gravity is to be as close to the base of support as possible, and the line of gravity should fall within the base of support. So, with respect to all these three rules, when it is present in an object, the object is said to be stable in nature. Now we talk about equilibrium. From stability, we attain equilibrium. Equilibrium is where the objects or a body are perfectly balanced and the body remains at rest. You have three types of equilibrium that is seen: the stable equilibrium, the unstable equilibrium, and the neutral equilibrium. The stable equilibrium is a state in which the body tends to return to its original position after being disturbed. Something like this. So, as shown in this position, the body starts here, and when it is disturbed, it moves to either sides but always returns to its starting position. This is a stable equilibrium. Unstable equilibrium, in the opposite, is a state of equilibrium in which small disturbance will produce any change and cause the body to become unstable and not to return to the position where it started. Something like this. So here, when you see the body starts here, and if you're going to give it a force, it's going to slide away and never return to its starting position, making it unstable in nature. So this is the unstable equilibrium. The last thing that we are going to talk about is neutral equilibrium. Neutral equilibrium is when the body is displaced, it adopts its new position and remains at its new position. So a body, even if slightly displaced, remains at its new position and continues to be so unless displaced again. So this is known as the neutral equilibrium. So these are the three types of equilibrium that you will see based on the stability of the object. The best that the movement changes the equilibrium and stability of an object. Another important concept that we come across is speed. Speed is the rate at which body moves. Now it is not different, it does not differ with the amount on account of the direction. The speed remains constant. For example, the car has a speed of 60 kilometers per hour, meaning that it moves 60 kilometers in every hour. Average speed can be calculated by the distance upon time. This is a very important concept, especially when you're talking about movement of the body. So every uh, body moves with a particular speed. If, for example, the speed of walking, so everybody moves at a particular speed of walking, and it can be in any direction that you're going to move. The next important concept that we come across is the velocity. Velocity is, in simple words, speed with direction. So velocity incorporates the rate of motion but also the direction in which it moves. So speed meaning how fast you are traveling, velocity meaning how fast you are traveling in which direction. So velocity is speed upon time. For an example, the aeroplane travels at 1,000 kilometers per hour in an easterly direction. Change in either speed or direction can alter the velocity. So it is very important to know both the speed and the velocity of an object. Another important concept is the power. Power is the rate of doing work. Now, it is also known as the rate at which energy is expended. It is measured in joules per second or ergs per second. So, as you can see the calculations here, power is work upon time, force, and force into displacement upon time. So force into velocity. So these are the various ways in which you can calculate power. Power can also be meant as muscle power. So when you're talking about calculation of muscle power, these formulas are used to calculate them.
798511016. बरोबर आहे ना?
Okay, so now we come to the next thing, that is work. Now work is the product of force into distance. Now there are two things here, positive work and negative work. Now work, when it is done in moving in the direction of the force, is known as positive work. Now work when is opposed, moves in opposition to the force, is known as negative work. Negative work is like an example to that is the frictional force. The frictional force happens in the opposite direction of the force that you're going to apply. Now here the displacement is to stop the body in motion and hence negative work. Now in positive work, the displacement happens in the direction of the force, making it positive. Now when force is applied at 90 degrees to a motion, or when the object is not in motion, there is no work that is happening. So this is the way in which we describe the work performed by a body. So when you're going to lift an object, when the muscles are working and the object is moving in the direction of the muscle work, it is known as positive work. But when you're going to do a work such as keeping an object down, the muscle is working the opposite direction of the force produced, it is known as negative work. Okay, we come to again the next concept, that is energy. For whatever we do, whatever force that is required, whatever work we need to do, we need energy. Now when you need energy, you have it is the capacity of the body to do work. Now there are two types of energy: potential energy and kinetic energy. Potential energy is that energy which is stored over here, as you can see, and the kinetic energy that happens when you are in movement. Like when you move up here, there is energy that is taken in. This is kinetic energy. The energy that is stored here being potential energy, and the energy that comes out, which is again kinetic energy. As we all know, energy can neither be changed nor transferred. It can just be transferred from one form to the another. Example being from kinetic energy to potential energy. Okay. The next concept is the pendulum. So here, now when we finish the concept of equilibrium, we will also be able to know the pendulum. Pendulum is again a simple machine incorporating equilibrium as well as energy system. It is a weight that is suspended by a simple thread. So here you can see maximum potential energy. You give it a force, it's going to come back here where it has maximum kinetic energy, moving to the other side which has maximum potential energy. Now remember, the pendulum, as soon as the force is lifted, comes back to its neutral position and returns back to its original position, making it a stable equilibrium. Similarly, motions of the upper limb or lower limb from the shoulder or the hip joint can lead to pendular movements, which are good exercises and which can help the body in different movements. So this is an example of a pendular movement. The next thing that we come across is another simple machine, which is known as the pulley. Now pulley here is a grooved wheel which is rotated on a fixed axis and a rope passes through the wheel. Okay, so there is an effort on one side and there is a load on one side. Now what do pulleys do? Pulleys help us lift heavy loads, and it reduces the force that is required to pull this load, changes the direction in the force that is applied, and provides a mechanical advantage. So if you see, this force here is 400 newtons. It's going to be very difficult for an individual who's weighing say about 60 to 70 kgs to exert a force to move this load. So what we do is, instead of pushing or pulling, you attach it to a simple machine, that is a pulley, and exert effort here, which is going to be half the force that is otherwise required, making it easier to lift this load. Pulleys are generally used in lot of machines, in lot of engineering departments. Okay, for a human body, when we use pulley, it is to reduce the force that is required by the muscles to move the body part, and thus gain mechanical advantage, assisting in lifting the body part itself. Now what are the types of pulleys? You have fixed pulley, you have movable pulley, and you have something called as compound pulley. Fixed pulley is the one that is just going to alter the direction of the force. It is going to again have a fixed axis, a groove, and a rope that is going to pass along it. It enables traction or resistance to be applied in an angle. So this is when you're going to apply a pulley for human body. The next system that we are going to see is the movable pulley. Now, movable pulley is going to give you another advantage where you're going to pull this load and the entire system moves up. It gives you a mechanical advantage twice that of this fixed pulley, thus making it much more easier than the first section. The next thing is the compound pulley. Compound pulley, as you can see here, is the combination of a fixed pulley as well as a movable pulley. Again, changing the force and reducing the force much more compared to the other two. Fixed and movable pulley working together is the system which is used commonly to lift quite heavy loads like cranes, etc. So these are the different types of mechanical pulleys that we happen to see in our daily life. Now, how is this connected to human body? Now, when you have pulley systems which are functioning in human body, these are known as anatomical pulleys. Now, these change the direction because of muscle force. The bone or the bony prominence that is causing the deflection acting as a groove is known as the anatomic pulley. An example of this is the patella, the quadriceps muscle here, and the force generated by it to cause tibial extension. So as you can see, the quadriceps muscle originate from here and are inserted into the patella and cause knee extension. The patella here acts as a groove and a pulley. The force by the quadriceps muscle moving the load here, that is the lower limb. So this force contracts quadriceps in this direction, causing the tibia to extend or causing the leg to extend in this direction. So this is the example of anatomical pulley. Another example is the lateral malleolus of the foot, wherein you have the peroneus muscle going across them. Now, anatomical pulleys are of four classes. Class 1, where the bone itself is acting as a pulley, that is the patella. Class 2, where it is either a cartilage or another bone, another surface that is acting as a pulley, that is like a lateral malleolus. The third class, wherein muscle acts as a pulley to another muscle. So here an example is the biceps brachii and the brachialis. So brachialis is a muscle that is placed down. Biceps is a muscle that is placed above it. Now here brachialis acts as a pulley to increase the efficiency of the biceps muscle, making the muscle, the brachialis muscle as an anatomic pulley. So these are the types of anatomic pulley. Now anatomic pulley, like in mechanical pulleys, reduce the force required for movement and help with an mechanical advantage. The next thing that we are going to look at is the muscle mechanics. So how does muscle mechanics function? How do they alter the forces and how do they cause the movements? So muscle mechanisms for any muscle, there are three types: cardiac muscle, smooth muscle, and skeletal muscles. Skeletal muscles are the most abundant tissue in the human body. They provide strength and protection for the skeleton, enable bones to move, and provide maintenance of body posture against gravity. Now, we will look at the muscular system. So this is how it starts. You have a muscle, you have the fascicle, the muscle fiber, the myofibril, and then down to the lowest unit, that is the myofilaments. Functions of the muscular system are to produce body movement, to maintain posture, help in respiration, production of body heat, communication with gestures and movements, constrictions of organs and vessels, that is helping in circulation, and heart itself causing heartbeats. Okay, so these are few of the muscle functions that happen in our body on a day-to-day life. The next thing is the classification of muscles. So how do you classify them? There are 6 types here. based on the tissue type, based on the action that they perform, the fascicle orientation, based on the types of muscle contraction, the fibers that are present in the muscle, and the joints that they cross. So let us cover each one of them individually. So first one, based on the muscle types. So what are the different classifications? First one, as we covered ahead, is the skeletal muscle. So it is attached to the bones, has multiple nuclei peripherally located, can be striated, voluntary and involuntary. The next thing is the smooth muscles, which are present on the wall of organs, blood vessels, eye, skin, glands, etc., which has a single centrally located nucleus, no striations, and is involuntary. The other thing is the cardiac muscle, which is present at the heart. Again, single centrally located nucleus, striations present with intercalated disc. Now, these are the three types of tissue muscles based on the muscle tissue. The next thing is based on classification of their actions. So you have a prime mover or agonist, which is the biceps brachii when an elbow is flexed, a synergist, which is helping the movement to occur, an antagonist, which is preventing the movement from occurring, and a fixator, which is helping the movement to occur. So, which prevents other joints to move. So, in an example here, the biceps, which is helping when the elbow is flexion, the brachioradialis, which is giving an additional support to the biceps, the triceps brachii, being the antagonist, which limits the motion, and the scapular muscles, which prevent the excessive motions when the biceps contracts. Okay, so this is the muscle classification based on what type of actions they perform. The other one is based on the type of muscle fascicles. So you have so many fascicles, that is the orientation differs. The first one is fusiform, where you have the tendon, the belly, and the tendon. The parallel form, where the fascicles are laid parallel to each other. The convergent type, where it is larger on one side, converging to the smaller end. The unipennate or the pennate muscles, which is divided into unipennate, which is on one side, bipennate on both sides, and multipennate, forming the pennate group of fascicles. Then you have the circular fascicles, which are round in shape. So examples for each of this are biceps brachii or gastrocnemius, being in the fusiform type. When it is parallel, something like the rectus abdominis. The convergent type, where fibers converge to form one end, come to one end, are the pectoralis major or temporalis. The unipennate type, which is the intrastripe, palmar or dorsal. The bipennate, which is rectus femoris. Multipennate, something like a deltoid. And circular muscles like orbicularis oris or oculi. So these are the various other muscles classified based on the type and orientation of the fascicles. The next thing that we move on to is based on the muscle function. So based on the muscle contraction, you have two types, isometric and isotonic. Isotonic again has two types, which is concentric and eccentric. Now let us see what do each of these mean. Isometric is, as the name says, iso means same, metric means length. So isometric means same length. So no change in length, but tension increases or decreases. There is a change in the tension. So that is the isometric type of contraction. Examples are the postural muscles of the body. The next thing is the isotonic contraction, where, as the name says, iso means same, tone means tension. So where the tension remains constant, but the length can vary. Now this, as you see, are of two types, concentric and eccentric. So in concentric muscles contraction, the force overcomes the resistance and the muscle shortens. In an eccentric contraction, the tension is maintained, but the muscle lengthens. So these are the two types of muscle contractions, and muscles are classified according to how they contract. Muscle tone means constant tension by muscle for longer period of time. Now, concentric muscle is an example of concentric muscle contraction is when you lift a dumbbell. So when a biceps is moving, when the elbow is moving towards each other, there is elbow flexion, concentric muscle contraction. Now, when you bring that same dumbbell down, but in controlled motion, it is known as an eccentric contraction. So these are the various types of muscle contractions that we see in our daily life. The next classification that we are going to see is based on the fibers. So as we know, there are slow twitch fibers and fast twitch fibers. Slow twitch are highly oxidative. They contract more, have more mitochondria, and are more fatigue resistant. Fast twitch fibers are low oxidative. They respond rapidly. They have more ATP and fewer and smaller mitochondria. Now, as the name suggests, slow twitch fibers are used when you need muscle contractions for longer duration, something like standing, walking, etc. Fast twitch contraction or fast twitch fibers are present in muscles which are required for immediate energy, something like when you need to compete in a 100-meter dash or a 100-meter race. But in general, muscles have both fast twitch and slow twitch fibers. Now, effects of exercises can be increase in the muscle size, that is hypertrophy, or decrease in the muscle size, that is atrophy. Now, all this depends on the type of muscle fibers that are present in the muscles. So, based on this, they are classified as slow twitch muscle fibers or fast twitch muscle fibers. The next classification we move on is based on how many joints the muscle cross when they are moving from origin to insertion. One is known as the two joint muscle or the multi joint muscle. Now, the movement effectiveness depends upon the location and orientation of the muscle's attachment relative to the joint, tightness or laxity or lack of the muscular tendinous unit, the actions of the other muscle causing a joint. Two joint muscle is when the muscle crosses only two joints, and multi-joint muscles are when they cross more than two joints. Okay. The disadvantages of this feature is something called as insufficiency, either active or passive. Now let us learn about the insufficiency. What is insufficiency? It is the disadvantages of two joint muscle, wherein you have two types, the active insufficiency and the passive insufficiency. Inactive insufficiency, it is known that muscles cannot shorten and produce full range of motion at both joints simultaneously. For an example, if you have to hold an object in wrist flexion. So when you do wrist flexion and also flexion of fingers, there is an active insufficiency of these muscles. These would be the multi-joint muscles. The next type of insufficiency is the passive insufficiency, which says that muscles cannot be stretched to allow full ROM at both joints simultaneously. For an example, when you stretch the wrist in extension, your fingers naturally fall in flexion. Why is this so? Because the long finger flexors cannot be stretched at both joints due to passive insufficiency. So this is active and passive insufficiency, which happens for two joint or multi-joint muscles. The last section of this segment is the summary. So what have we learned today? We have learned about biomechanics, how mechanics happens with respect to the human body. We have learned about kinematics and kinetics. Kinematics being motions occurring, kinetics being the forces that are causing these motions. Kinematics are further divided into two things: Osteokinematics and arthrokinematics. Osteokinematics, wherein you have movement of the bone. Arthrokinematics, which is because of movement of the joint surfaces. Osteokinematics is further divided into open chain kinematics and closed chain kinematics. Open chain kinematics, where the distal segment is free in nature. The closed chain kinematics, where the distant segment is fixated. These are the broad classifications on biomechanics that we covered today. We move to the next segment where we learned different terminologies in mechanics affecting the motions of the human body. Few of them are here. The axis and planes. So we have an axis which are three in nature: sagittal, frontal, and coronal. We have the planes again, which are three in nature: sagittal, frontal, and horizontal. We covered the forces, the different types, the laws of forces, and what happens when two forces which are balanced or unbalanced happen on the body. Next that we covered are the laws of motion, that is the Newton's law of motion, which is three: law of inertia, law of mass and acceleration, and then law of action reaction. Okay, so these are the three laws of motion that we covered today. The next thing that we covered is the friction force. So now two of them, gravity and friction, which are the long distance, uh, one which is the long distance force, other which is the contact force. Now friction forces and how do we reduce them, how do we stop them. So these are basically based on the use of wheels or roller skates, on use of lubricants, or on the surfaces that we are working on. Gravity is responsible for most of our functions. It has center of gravity or center of mass, line of gravity which is passing through the center of gravity, and a base of support which is responsible for having stability. Now center of gravity for symmetrical object is same as the geometrical center, and for asymmetrical object it is falling at a place where there is heavy mass. Stability happens where the center of gravity is closer to the base of support. The base of support is large and the line of gravity passes through the center of gravity and to the center of the base of support. So these are the three rules that ensure that the object remains stable. The next thing that we are going to see is the equilibrium. The types that we saw here were stable equilibrium, unstable equilibrium, and neutral equilibrium. We also saw the factors that are affecting the equilibrium. Other concepts that we read about are speed, velocity, power, work, energy, and all of these features and how they affect the human body motions. Simple machines that we covered today are pendulum and pulleys, which help us produce muscle force, utilize muscle force with a mechanical advantage. The last section that we covered are the muscle mechanics that help us to achieve the biomechanical movements, the functions of the muscles classified according to their various features, and the disadvantages of two joint or multi joint muscles, which is the insufficiency that can be active or passive. So these are the few topics that we covered today, which are known as the basic biomechanical principles on which the human body functions. We also covered movement or force that is happening in angular motion, that is known as the torque. Okay, now all of these forces help the muscles to move the body parts in a particular angle or a range of motion. Okay, so the angle at which the muscle pull is maximum is known as the angle of pull. So these are the few concepts that we have covered today. The reference books that you need to go look into are Dina Gardiner and Cynthia Norkins. Thank you. Do we have any queries here? The forum is open for queries. Does anyone have any query?
Ma'am,
Yeah.
in equilibrium, the center of gravity and line of gravity, how it's affected?
Okay, so for an object to be in equilibrium, the center of gravity, the line of gravity has to be within the base of support. Now, when you see equilibrium, if you have a stable equilibrium, you should have the center of gravity closer to the base of support. The line of gravity should be passing through the center of gravity and falling within the base of support. So, for an example, when you're standing with your feet wide apart, okay, so here the center of gravity is at your S2 level. The line of gravity is the straight line that is going to pass through your body, and the base of support is the area between your 2 feet, which is wide. So this is a stable equilibrium. Now, as and when you get your feet closer to each other, the base of support reduces. But when your feet are still close to each other, your line of gravity and the center of gravity are still within the base of support. Now, what happens when you're doing standing on one leg? Now, this is where your equilibrium changes, your stability changes. So, here the line of gravity does not fall within the base of support. The base of support is the one leg on which you are standing. When the line of gravity is away from the base of support, does not fall within the base of support, you have an unstable equilibrium and a person can fall. Okay, so this is how equilibrium, line of gravity, center of gravity, and base of support are connected.
Thank you, ma'am.
Any other queries?
Ma'am,
Yeah.
what will be the base of support if we are supine or we are when we are kneeling?
Okay, these are again two different conditions. When you are in supine position, your base of support is the entire body height. Either if you're lying on a plinth, then it is going to be the entire area of the plinth that is there. That will be your base of support. When you're going to be kneeling, it is going to be between the points of your two knees as well as your foot that is placed on the ground behind. So kneeling will have two contact points from two knees to the 2 feet that are there behind. The area between that is going to be your base of support.
Okay, thank you, ma'am.
Anyone else?
Ma'am,
Yes.
could you explain active insufficiency and passive insufficiency?
Okay. Now insufficiency happens when you have two joint or a multi-joint muscles. Now the examples that I spoke of is a multi-joint muscle. What do you mean by multi-joint? Is when the muscle crosses multiple joints. Like if you're talking about finger flexors, like FDP and FDS. Now flexor digitorum superficialis and flexor digitorum profundus. This is going to come from the common flexor origin, cross the wrist joint, cross the small finger joints at PIP, MCP, DIP, all of those, making it a multi-joint muscle. Now here, if you're going to keep your hand like this, and you're going to flex the wrist and flex the fingers in order to lift an object. So if you're going to lift something in this position, the force exerted by these muscles are going to be at an active insufficiency, because the force is going to be reduced as the muscle is working both at the wrist and also at the fingers. This is known as active insufficiency. Now, the opposite of this becomes passive insufficiency. Passive insufficiency is when you're stretching the muscle. So when you're doing a wrist extension, your fingers are naturally going into flexion. Now, this is because the muscles that are coming across from here are at a disadvantage, making it passively insufficient. So this is known as passive insufficiency. Similarly, when you're going to do wrist flexion, the fingers fall into extension naturally. This is because of passive insufficiency of the extensors that are again crossing multiple joints. Is that clear?
Thank you, ma'am.
Right. Any other queries? So these are the basic biomechanical principles that we are looking at, and this is how you will be able to work with motions occurring in the body and correlate them to the physics and the mechanical forces that cause these movements. Any more queries?